It sounds like there's just a lot we don't know. Is that fair?
That's fair. And you know, one thing we don't know, St. Louisans don't know that we're sitting at the epicenter of worldwide research. You're looking at, you know, St. Louis University and Washington University. So I will say this about them. We're at the epicenter of that. We're at the middle of the first prevention study that's ever occurred. And we've got things that are going on that nobody else has going. We're really proud that here in St. Louis, our chapter certainly realized that, and so we're proud that we were part of funding Diane and getting it. $4 million is really a drop in the bucket when research goes, but we were there to be a part of getting it jump-started through grassroots. When the big dollars, the research dollars at NIH, they hadn't loosened up their dollars yet, and now that's come, and we've got 26 million, but still not enough. So that's an example of where the grassroots research can help make this, you know, go forward. But the people don't know that St. Louis is sitting right in the epicenter of research.
I guess if a person has Alzheimer's, they can't really lobby for themselves either. They can't necessarily make a trip to Washington and hold a rally.
Right, right. I had the great fortune of being invited to speak before the U.S. Senate Special Committee on Aging on behalf of caregivers. And one of the most exciting things about that opportunity was that the Senate wanted to hear about the plight of caregivers. It wasn't just about research dollars and finding a cure, because before there's a cure, there's care. When people with Alzheimer's go into the hospital, they spend an average of 9.3 days in the hospital. When someone of the same age without dementia goes in, they spend an average of 3.3 days. So it'll be wonderful to find the cure, but before then, let's help families who are in the homes know how to deal with dehydration and know how to deal with bed sores and constant repetition, so they can take care of it at home, decrease the costs for the hospital, for the public and private sector. And that's what our program's been able to do.
Again, because the patient just, like, they can't go to Washington on their own behalf. They can't advocate for themselves and even tell the doctor what's wrong in some cases, I guess.
Great point. And I think that one of the things that's really critical is because there is not screening going on in many, many hospitals, or with emergency room or advanced practice paramedics, there is training going on for someone who may not be able to actually employ it. So we are actually involved in a partnership in which we're helping to help screen with the emergency room and with the advanced practice paramedics at Christian Hospital, so that they can know who can actually benefit from this sort of training and give that instruction to a caregiver so that they can implement it.
I was going to say that, related to your comment about Alzheimer's patients not being able to advocate for themselves, which is a huge issue and one of the reasons why I think we don't have as much in the way of research dollars as other diseases do, is also the notion that before we called this Alzheimer's disease, it was called senility. We didn't really understand it, but it was Alzheimer's disease, but we called it senility.
Something that just happened when you got old.
Right, and not only that, but there's a stigma of senility is a mental illness. There was a stigma of mental illness. So even families were not as upfront about saying that my mom or dad is senile or has senile dementia. So even with Alzheimer's disease being a bit more of a scientific term, we now use major neurocognitive disorder. We don't use dementia even anymore, because that's thought to be derogatory. Things are changing, but not as much as with other diseases where the patient herself or himself can go and lobby and say, I've got horrible diabetes. Look at my leg, it was cut off last year.
I can't breathe, I've got pain in my arm.
I can't breathe because I got, emphysema. Look at this mask I gotta wear all the time. That is traumatic. Alzheimer's patients themselves can't do that.
But you also need to think of also the context of the community. We're still not getting into enough other communities. In particular, in the African American communities, we really need to make further strides into that. They're starting to occur. You're starting to see, working through churches, working through other organizations, working through YMCAs, working through the Alzheimer's Association, and they're doing fantastic work here. We need to do this because there are certain cultural customs and norms that you've been hearing about that people have kind of just said, oh, that's normal aging. If I get a little bit more impaired, that's nothing. That's what it should be. It shouldn't be. People need to be looking out, need to be screening, need to be thinking, and need to get into those communities, because you're going to see it. It's an untapped area of African Americans.
And if it's associated with mental health, that we've talked about that on this show before in different communities, that has a stigma that is even stronger in some places.
Think about Alzheimer's disease. All of its symptoms are mental. The #1 reason for Alzheimer's patients ending up in a nursing home is behaviors, safety issues and behaviors that the family can no longer deal with. And those are not easy. Anything mental, okay, is difficult to deal with. And you know how much discrimination we have in our society, unfortunately, against things that are mental. And I agree with you 1,000% about the unmet needs in the minority communities, whether it's the aging Latino community in the city of St. Louis. With the Alzheimer's Association's help, we're hoping to set up clinics in North St. Louis for African Americans. A lot of unmet needs.
And a lot of work still to be done.
Yes.
Thank you all very much. Lisa Barron, Stacy Tulavaz, and Dr. George Grossberg, and Dr. Bo Ansis. Thank you all for all of your time. And don't forget, next week, January 25th at 9 p.m.,